And now I have the great pleasure of introducing the new National Reach Out and Read Chief Executive Officer, Marty Martinez. As Chief Executive Officer, Marty Martinez leads the Reach Out and Read network, including more than 6,000 program sites in all 50 states and nearly 30 regional, state, and local affiliates. Marty brings nearly 25 years of experience working on behalf of young people, families, and underserved communities across the greater Boston area. He has developed a strong skill set and expertise in public health, nonprofit management, and positive youth development. He recently led the city of Boston through some of the most pressing social and community challenges, including COVID-19, as the Chief of Health and Human Services. Using his personal story and professional experiences, Marty has become a community leader who has dedicated his career to centering equity at the heart of his work to break down barriers and create systemic opportunities to advance the lives of his neighbors in Boston and beyond. Marty, we are so happy that you're here. Welcome.
Thanks, Emily. Thanks for having me. I'm really excited to be here.
Absolutely. For those of us who haven't had the pleasure, tell us a little bit about yourself and what inspired you about Reach Out and Read.
Yeah, so thanks for that. For me, Emily, it's been an exciting time to think about where Reach Out and Read is, where we're going, and where the organization can build upon 33 plus years of a really solid foundation. For me personally, as you said, I've been in the greater Boston area for about 23 years. And like most big cities, that to most Bostonians, that mean I just got here. I haven't been here long enough to be a true Bostonian yet. But I've spent my entire career building opportunities and resources on behalf of families impacted by a variety of social challenges in our community. And so I'm excited to be able to use that experience as a nonprofit leader, as a government leader in this next chapter, and really eager to connect the work we're doing in every state and every city to really continue to build a national movement that is Reach Out and Read. So I'm eager and excited to be here and join all of you for the sort of the conversation and the tail end of Dr. Yagman that made me think I have all kinds of notes that I just took. So I appreciated that as well.
Oh, it's wonderful. Yeah, we're so excited. I know you're just about 2 months in so far and meeting with sites and stakeholders. What, if anything, surprised you, and what are you seeing on the ground level that's informing your vision for Reach Out and Read National?
Yeah, absolutely. So before spending 4 years in city government and when I became the Chief of Health and Human Services, I'm not sure that I didn't know a pandemic was coming and that I would be in the role that I was in leading the city's COVID response. But before that, I ran a statewide affiliate for a mentor called Mass Mentoring Partnership, where I was building youth development organizations and supporting youth mentoring programs all across the state of Massachusetts, embedding developmental relationships for young people in every corner of my home in my state, as well as across the city. And in that work, I learned a lot about the power and the sort of dedication to relationships for young people that so many professionals had. And I think in my learnings thus far in meeting with individuals, obviously we had the opportunity to meet in person in New York City, which is great. But in meeting with people from all over the country, whether it's virtually or in person, the passion for Reach Out and Read, you can not only read about it, but you can touch it, you can see it, you can see the work that people have done over the years to really embed this model in pediatric primary care. So that passion, I don't know if it surprised me, but I was excited to see it. I was excited to be able to understand it, which has really been an amazing asset for the organization. I've said to many that Reach Out and Read feels like, to me, as in many ways, a scrappy organization that's been able to do a lot with a little. It's been able to take an amazing evidence-based model and really embed it in over 6,000 clinics in every state in the country. And to me, that's truly exciting. It means that you have champions for this work all across the country, like yourself and everyone here in New York City and across the state. And so for me, it's been nice to see that. It's been nice to sort of understand it. And hasn't surprised me, but it's been a nice addition as I've gotten started in this role.
Mm-hmm. I think scrappy is a core value for us coming out of the pandemic. Well
Exactly.
said. Um, I'm curious, with your experience working in public health in Boston through the pandemic, how does that impact how you think about Reach Out and Read and our ongoing work through the pandemic?
Yeah, yeah, absolutely. I mean, I think one of the things that, the work that I learned, during COVID and sort of in my role, I have a public health background. For my first job, sort of both in college and out of grad school, was really doing public health work, serving in a public health Latino agency here in Boston, and so I sort of brought that experience into my job. So public health for me, which is really population health, right? It's ensuring that all people and improving the health of all people within a geography, a community, et cetera, and making sure that we're not just focused on the individual, as important and powerful as that is, but that we're really thinking about the aggregate and how we're lifting up communities and improving health overall. And so for me, that's the experience that I sort of brought into that job. That I had for the city and that I bring with me into this role with Reach Out and Read. But what I will say is that through my job at the city, one of the things I learned working in municipal government, and I stress that because municipal government, at least here and in many places, isn't known to be nimble. It's not known to move quickly. It has a lot of bureaucracy, as most levels of government do. But during COVID, we had no time for bureaucracy. We didn't really have time to not be nimble. We had to move with urgency and intentionality. And doing that in the public health realm is somewhat, at times, there's opposing forces, right? We need to plan, we need to be careful, we need to be methodical, we need to have all the research, all super important. But I would argue we need to move with urgency around some of our public health challenges. And so as I bring that sort of lens with me into this role at Reach Out and Read, I want us to do that. I want us as a national organization to continue to think about our work as a public health intervention. How do we ensure that we're truly universal? How do we ensure that we're, not only making some amazing impact in specific clinics and specific populations, but how are we actually at the table thinking about the health of all children in the earliest developmental stages for all children in a community, in a city, in a state? That's really the public health lens that I think we need to be at as Reach Out and Read. And I'm eager to sort of build upon the amazing work that's come before me. And I'm eager to sort of strengthen that foundation and really center us in that public health conversation. More than ever now, unfortunately, because of COVID, people know what public health is, and people have opinions about public health that maybe they didn't have before. And now we need to, though, leverage that intention and the need to sort of move with urgency. And that's exactly where we should be, because we are central to the health of all children across the country.
So important, so important. And part of how we were thinking about the whole child in designing this conference was to think about emotional and mental well-being for the child, but also we're thinking about that in terms of parents and caregivers. And then also our medical professionals. We're very concerned about burnout and the toxic stress that's impacting the medical professionals in our community. What is your perspective and your thoughts on that as it relates to Reach Out and Read?
Yeah, I mean, there's no question we're sort of in a moment where so much of, we talked a lot over the years about the social emotional supports that are needed for children. We talked a lot over the years about the impact that mental health challenges have on caregivers and parents when they're thinking about the development of their own children. And again, sometimes we've talked about it around workforce, including medical providers, and I would argue staff of Reach Out and Read across the country as well in that. But what COVID did is it sort of shined a light on all those things. And it sort of said that, we really have experienced, a natural, if you will, there's a better way to say this, but a natural disaster nationwide and across the globe. And so now, because of that, we have an opportunity, and it's hard to think of opportunities that come from COVID, but we have an opportunity to really elevate the supports around mental health, the supports around mental health wellness, and really talk about that work in a way that is concrete, that we can actually strategize real solutions to think about how do we build stronger supports for mental health wellness, not only for parents and children, which is so critical, especially children. Children were dramatically impacted, whether they're, 1, 2 years old or school aged, dramatically impacted children were by a variety of different systems that sort of went away or went dark during COVID. But staff as well had to figure out how to do things in a way that they didn't normally have to do before. And so we have an opportunity to sort of think really tactically about what systems we need to strengthen, what do we actually need to call out, and where we need real solutions to improve mental health wellness and support. I will tell you this on a personal note, we've met in person, but I haven't had a chance to meet so many. I'm a very jovial relationship hugger kind of person. I come from a big Latino family, and so that is key to building connections and building support. And as someone who couldn't do that for several years, it was a challenge. And it was a challenge that I think greatly impacted not only my emotional, who I was in the moment and how I develop and think about my work. But that's just a small example that's magnified by millions of other individuals who've had those experiences. And so we have a lot of work to do. And again, we need to do it with urgency, not plan for the future, but try to focus on it now.
Absolutely. Absolutely. I have one more question, then I see some Q&A coming in the chat, so I'll protect some time at the end for that. Curious, as you're thinking about Reach Out and Read as a national organization or a national impact, what role do you see New York City playing in that?
Yeah, absolutely. I think it's so important when we talk, so often we talk national organizations and including Reach Out and Read, we talk about, growth with quality, right? It's not just about more numbers, but it's about quality numbers and quality sites and making sure that the model that we all care deeply about is scaled with fidelity, right? We talk about that growth. I really see us having an expanded role in national conversations and national tables about who we are, what we believe in, and how we contribute to the health of all children. And I also want to really make sure that we are central to what's happening, not only for all children and parents, but when we think about child development, public health, and really how do we grow the health of all communities? Because an early indicator of health of community is the health of the children in that community. That is very key, and public health officials know that. The way I see New York, a part of that is that I think we have to learn what's happening on the ground effectively in clinics, in communities, to really understand what's happening that's working. How do we lift that up? How do we grow that across the country? What's happening that's not working or needs more support? And how nationally do we help meet those needs and work together? One of the things I said to you when we met, Emily, is that I want us to be bold together. I want us to be bold as a national organization, working with regions, working with science, working with clinics, so we can create the innovative solutions that we need to. So to me, that's how I see you all central to that, and making sure that what you're learning that's working, we can replicate across the country, and together build supports to make it even better.
I love that. Scrappy and bold. That's us.
Exactly. 100%. I like that, right?
That's great. That's great. I see a question from Yanilda from Bellevue. I really like the vision of Reach Out and Read as a public health intervention. What are some of the strategies to move toward that vision?
Yeah, I think I appreciate that question. I think for me, some of those strategies really have to do back to the earlier question of what do we do on the ground? Who are our partners in the community? What tables are we at? What conversations are we engaged in terms of how we do the work we do, right? We can have an amazing clinic and an amazing, whether it's a safety net hospital or a great federal qualified health center or another clinic, but we don't want to do that in isolation. So it's really important that on the ground, we know who we're talking with, who we're connected to, because that's the start of that, right? If a community says, listen, we want to strengthen the health of all children in our city, Reach Out and Read should be one of the first organizations that they're saying, hey, you got to be at this table. So we really need to think about who we're in partnership with, who we connect with, and what web of supports are we sort of part of. We need to be connected to that ecosystem. So to me, everybody can do that. On a national level, we need to make sure that we're opening up national doors to connect those, the work we do to the big movements around strengthening and addressing social determinants of health. We really need to make sure that we're sort of in those places. And so people see Reach Out and Read nationally as a partner to do that. So that's what I think I need to do on a national front. But I think every single person in a clinic, every single person who's driving supports through a region or through an affiliate has the ability to sort of look around and say, who am I with? Who am I talking to? And make sure that we are part of the larger ecosystem. I think that's one of the big things we can make sure we're doing.
Absolutely. Absolutely. Another question coming in on our Q&A, Dr. Yagman, the previous speaker, shared that over 100,000 children in New York have lost a caregiver due to COVID. It's a heartbreaking statistic. How will Reach Out and Read address that issue?
Yeah, it's a great crowd at the high level. I mean, I think we have to remember that. We have to remember that during COVID, we saw a loss of life. We saw an impact on, life expectancy in a way we haven't seen in generations. And so I think that we have to make sure that we are really thinking about how our clinical partners are well prepared for some of the realities of what has happened during COVID, that we as an organization are sort of at the intersection of other supports being built around childcare, around, early access to Head Start and early access to early learning. We have to just make sure that we understand what's happened to people. And that really also we understand what's happened inequitably to certain communities, specifically Black and Latino communities across the country. So it's really important that that context is part of how we're trying to be present and be there. And I'll say that's been central to us as we think of parent voice. We're going to strengthen parent voice in our model nationally, and I know that's something you'll want to do in New York as well. And we have to make sure that we understand that, because parent voice in some places is grandparent voice, it's guardian voice, it's because that has really dramatically been impacted by COVID in our communities. So we have to understand that context and lean into, as complex as it may be, how do we make sure that the right voices are there to shape what we're trying to do?
Yes, yes. And another question in our Q&A dovetailing with that, with the AAP statement of toxic stress and the emergency for children's mental health, do you feel that there is a sense of urgency to embed the work on early relational health in all clinics nationwide? Given your experience in public health, how do you envision these efforts moving forward?
Yeah, it's a great point. I think that there is an understanding of the fact that we sit in that, we sit in a very important point to promote and strengthen early relational health that's being built in these clinics. And I think that's key. To be frank though, there's more work for us to do. There's more work for us to do to make sure that in a clinic that, has Reach Out and Read, that maybe sees it in a narrow view or a narrow bucket, right? Oh, that's the program where I get a book and I give it to a child, but this is the stuff that I really do over here. We need to do a better job of integrating that into really the core care that a pediatrician or family doctor gives to children, and really center the fact that this is helping to strengthen the relationship being built with the child and a family and the provider. I just was at a panel this morning, and I had there was an insurance company CEO, a medical provider, and another person from the healthcare industry talking about innovation and the next chapter of healthcare. And the one thing they didn't talk about, but I had to leave so I could be here in time, so I didn't get to ask this question, was what are they doing to build trust and relationships, to rebuild that in the community? COVID dismantled a lot of that and shined a light on many of those challenges that already existed. And so I think we have to center ourselves in that, because as we think about mental health wellness for children especially, and for parents, there has to be strong relationship, has to be strong trust. And so we're key to that. Maybe people don't know that yet, but we're going to make sure they know that over the coming months, because we do, again, need to move with urgency.
Absolutely. Absolutely. We have time for one last question. Please share some of your successes in the area of mental health, reading, and children from the Q&A.
Yeah, so for me, I think one of the things that, I have spent a lot of time on is separate from my role at the city, as really having been working in mentoring relationships, whether it's the youngest of children or to older children, adults, young adults, etc. And for me, the piece I'll share with you is that that's been key for me is making sure that we embed in all of our programming and all of our services. I did this at Mass Mentoring and we'll bring this forward here. Children and families need to be able to show up as they are. They need to be able to show up in the moment, who they are, how things have happened. And we need to make sure that the system that we're working within can allow children and families to show up the way they are. I've developed programs that way. I've developed services that way. We cannot expect parents and families and children to adapt to the system that we're living in. We have to do a better job of adapting that. I've done that in my work and mentoring. I've done that in my work through Health and Human Services for the city, and I'm eager to partner with all the amazing people here at Reach Out and Read that want to do that across the country. So that's just one example, but I'm eager to learn from others as we continue down this journey.
Oh, wonderful. Marty, thank you so much for your time. It was an absolute pleasure. And we look forward to being a force to be reckoned with in championing early literacy together, bold and scrappy.
Appreciate that. That's from our new line, Emily, bold and scrappy.
That's it.
So,
I love it.
I love it. I appreciate it.
And wonderful comments in the chat also. Everyone's just so excited. Thank you so much.
Thank you so much.